so much for the invitation, Dr. Zaki and Health Asia, and my sponsors, the Super Technology Foundation, for bringing me here, and so I'm here today and able to speak to you. So about the title, so I just need your little patience, and it will make all sense on the end, I promise. So you just need to give me a chance for that. So the other side of the prescription. So first of all, who I am not. I'm not a medical doctor. I don't do surgery. I don't prescribe medicine. And basically, what do I do? And why am I here? So I am here because I would like to invite you to give me a chance to bring you on a journey to look at health from a different perspective, from a holistic angle maybe. So. Thank you. What health is? WHO said that basically health is not merely the absence of disease, right, and infirmity. It evolves a lot more than that, physical, mental, and the social well-being, if you probably know this by now. By my opinion, there is a highly secretive issue today which lies behind health problems, and that is the so-called feeling blue or depression. And if we are going to look at the size of this issue today, and if we Google it, you can see that it's almost 80 million hits on that depression. So basically, depression is behind all chronic illnesses. So just look at asthma, angina, arthritis, and diabetes. And 80% of the physician visits are actually coming from depression, and it affects everyone in the family and in the society. And by 2020, depression is projected to be the second leading cause of death. And 80% of the people walking around among us, and you have no idea who they are. So while those people are walking around, basically, what happens while they are taking a little unconscious rest from their chattering mind is they are taking up time with other issues like temporary reliefs or other behaviors just like so, like eating with other addictive activities. Now, how much does it cost us? Because you might wonder on that issue. So basically, I just bring you some data from Australia, and that some of the countries are actually bringing this data us. Let's see. For people not coming to work due to not feeling blue, that's about $1.2 billion a year, and it costs about $10,000 a year per employee. Now, what happens when these people actually come to work, to the job, and they only work 40% of their capacity? And if this lasts between 6 months to 2 years, this would actually cost, it does cost in Australia $2.3 billion a year, a person per year. You might wonder why. So basically, when you look at one of the consequences of emotional feeding, that's obesity. And obesity is pretty prevalent now, as you know, as 50% of the adult population are overweight or obese, and 30% of the children in the developed countries. And every third child in the US will have diabetes. And then you might wonder why the American army is freaking out, because there will be not enough soldiers going to the army. And did you know that in Australia, actually in South Australia, in 5 years' time, the budget, the national budget of health will be completely covering diabetes only. Now, children. let's just look at basically childhood obesity. And there are almost 3.2 million hits on Google on the treatments of childhood obesity using diet and exercise. Now, my doctoral research actually focused on using diet, targeting blood sugar regulation, and lifestyle exercise to look at obesity, how it actually affects obesity and the metabolic consequences in children. Now, all this affecting or targeting behavioral driven change in the lifestyle. You may like to put my last name in PubMed, and you can get the rest of the study. And I just like to show you what we did. We did 2 times 12-week studies. The first one was a glycemically controlled diet only. The second one's with the addition of a 45-minute walk. And basically, we found that this little 3-month work was significantly affecting metabolic changes, and risk factors was the hunger scores. And there was no additional change due to the walking program because it wasn't intensive enough and it wasn't long enough for children. And what we actually found 2 and 3 years later as a follow-up, the changes were sustainable due to the maintained BMI, which we were very proud to see. Now let's just have a look at what we've been talking so far, and that is depression. Depression basically affects the entire society, not just the person himself, the family, the profession, friends, and basically it's another leading cause of the chronic degenerative diseases. And one of them is basically obesity, which is by itself is a problem, not only just an extension, and it is part of metabolic syndrome as diabetes and heart disease as a consequence. Hence, it reloops back and feedbacks back to depression. Now, what do we do? You might wonder that if something is so complex and multifaceted and highly integrated as a problem, wouldn't you agree that the solution, which is multifaceted and integrated, should be used? So basically, Alive is a multidimensional and experiential-based education program for lifestyle, which basically addresses 4 major parts of our lives, and that is how we think, how we eat, how we move, and how we rest simultaneously. This program gives an experiential learning and a positive reference experience, which is, we know that it's a foundation for long-term behavioral change. And this is how it looks when we do Alive. So basically, you can see real participants of really doing health, and some more, and some little one more here. And here we go. So we are doing really highly integrated and multidimensional angles on treating health and doing health. And just a little questionnaire follow-ups on what we do. So people who went through our programs, they found higher self-control and self-confidence, dedication, better decision-making, positive focus, being systematic, healthier, eating better, losing weight, and a fast recovery and high efficiency. Now let's see what happens when we look at people who've been in a program for 10 years. And that is, they have still high stamina, awareness and consequences of their actions. That means they are able to choose food. They have stable their body weight, their health is strong, they have self-correcting themselves once they slack off, they're happy and positive, and they are able to help others now to get on the road, and they're working highly effectively. And basically, 75% of the participants found an improvement in their health, and in their relationships, 50%. So that's pretty huge. We're not targeting anything on the profession, because these people are professionals themselves already. So basically, here comes the prescription, and I'd like to just show you my last words, again, in a multimedia form.
Thank you very much, Dr. Zsuzsanna, and